Hello and welcome to UK Fitness Hub. My name's Travis Tarrant and today we're going to be covering temporomandibular joint pain, also known as TMJ pain. We're going to be covering what it is, what the symptoms are and how to best self-treat it from your own home. Let's get into the video. TMJ pain, or sometimes as it's referred to TMD, temporomandibular dysfunction, is a common blanket term of pain and dysfunction which could be one of three things. So it could be pain and dysfunction of the physical TMJ joint itself, which is where my index finger is in front of the ear. It could be a ligament issue, or it could be dysfunction of the muscles in and around the face and jaw. So let's talk about the joint first. So joint-related symptoms would be a lack of range of motion, so somebody that maybe can't bring the lower jaw down very far. It could also be when you do range of motion, so when you bring the jaw down and side to side, you get cracking, popping, grating, grinding, the onset of tinnitus, those types of symptoms. And if it's more of a muscular issue, it can cause the onset of headaches, and it can cause the onset of earache, muscular fatigue, and soreness and inflammation. So let's dive into more of the muscular side first. So if I was to get a dumbbell and started doing dumbbell curls, my bicep after a period of time is going to get fatigued and start to hurt. So this is exactly the same that happens with the chewing muscles of the face. We've got the Masseter, which attaches at the ramus of the mandible to the zygomatic bone and zygomatic arch, so from where my two fingers are. And we've got the temporalis muscle that goes from the top of the jaw all the way up and fans up the side of the head. And if you're waking up with pain and dysfunction, headaches in the morning, it could be a symptom of during the night, during sleep, you're clenching your jaw, and if you're doing that, you're working those two muscles. And any muscles that get irritated, inflamed and sore with the head or the neck can cause the onset of tension headaches. Let's take a closer look at the joint itself. So we've got the temporal bone and we've got the mandible, and in the middle we've got the temporomandibular joint. So at the joint it's quite interesting because it has a synovial cavity that's split into two. So we've got the inferior cavity, then we've got a disc, and then we've got the superior cavity. Now these cavities are really important for the jaw to be able to allow the joint to freely move with lubrication, so synovial fluid. If we didn't have this, it would cause friction between the jaw and the skull. Now, when we bite and come up and down with the jaw, what we should see is it stay in contact with the skull. But what can happen if somebody has an unstable jaw, or alternatively a bite issue, is that the jaw comes out and clicks back in. Hopefully you can hear this on the audio, like so. It can be more pronounced if somebody has an underbite as well, where it kind of pops back in. Now, this popping and the jaw coming out of the joint is going to mean that we're going to develop arthritis, we're going to break down the synovial cavities as well, which is going to lead to more pain and wear and tear. If we think about also where the muscles are, so if we've got an unstable jaw, Masseter muscle from my two index fingers, and then we've got that temporal bone that comes all the way up, fans out. Let's say we've got an unstable jaw and we go to sleep. What the mind's going to do, what the brain's going to do is it's going to relax. However, the muscles are going to go, well, I don't want the jaw sitting out of socket, so what I'm going to do is I'm going to clench up, I'm going to make sure the jaw stays exactly where it is, Masseter muscle engages, temporalis muscle engages, and they're going to just lock this in contact, or they're going to constantly contract and cause this grinding from side to side. And this is why these muscles get chronically tight. So what are we going to do about this in today's video? Well, we're going to start to strengthen the muscles that oppose clenching. We're going to massage the muscles that are tightened, and then we're going to work on some range of motion techniques. So if you have got a limited range of motion, we could start to increase that. Let's get into some of those techniques. The first exercise is chin retractions. You can do this standing or seated. Make sure that you have good upright posture with your shoulders back and your head looking forwards. Begin to bring your chin straight back and hold this position for a couple of seconds before returning back to the start position. A good tip on this one is try to imagine you're trying to create a double chin. Chin retractions are a great exercise to align the jaw and neck properly above the spine, and if we get neck strain, sometimes that can refer to the jaw. Complete 3 sets of 15 slow and controlled repetitions. Next, we're going to start to massage the Masseter muscle. Take both hands and place the part of your hand below the thumb underneath your cheekbones. Begin to massage in a circular motion. You can see how much my face moves even doing a gentle circular motion. If you find a particularly tender point, focus on that area and try to decrease tension. I would recommend spending 2 minutes on each side to begin with. And if you are doing 2 minutes, start off really gentle and slowly increase the pressure throughout the 2 minutes. Now let's focus on the other chewing muscle, the temporalis muscle. Because the muscle is a fan-shaped muscle and it spans across the side of the head, I like to use the whole flat of my hand for this one. I use circular motions and deviate from clockwise to anti-clockwise during the massage. Again, starts off really gentle, gradually building up pressure until the 2 minutes has elapsed. Next up, we're going to massage the posterior neck muscles and suboccipitals. Flow once again in circular motions. I like to use both my hands here with 3 fingers on each side, but you can also just use your thumbs or knead this area with one hand. The muscles in this region work overtime to keep your head balanced on top of your spine and are particularly prone to tightness. Where my hands are now, I'm on the suboccipitals, which consist of 4 muscles. This is a common position for trigger points, and it's important that we keep these muscles well maintained as they work to function directly with the muscles of the jaw. Massage for 2 minutes, covering up and down the neck. Staying with the suboccipitals, now they've been massaged and blood flows higher in this area, we're going to do occipital lifts. Place 4 fingers over your ears and with your thumb, place it on the back of your head. With your thumb, find the suboccipital muscles and begin to press down. Keep your thumb pressed as you begin to tilt the head slowly side to side for 20 repetitions. A good rule of thumb for positioning is to take your thumb and place it behind the middle of your ear, then slowly move your thumb towards the base of your head, and the first fleshy muscle you begin to feel most likely is the right area. Remaining with the back of the head, place both hands at the back of your neck muscles, just below where you begin to feel the skull. Then begin to slowly pull the muscles down. Once you've done this, you can either hold this position for 30 seconds or make the stretch more abrasive by tilting the head down whilst keeping pressure. If you choose the more abrasive version like I'm doing, do 5 very slow repetitions, resetting after every repetition. To stretch the Masseter muscle, you're going to have to be prepared to make an ugly face. Start with the palm of your hand at the bottom of your jaw and push up until you reach the cheekbone. At this point, begin to open your mouth and you should feel the masseter stretching as your mouth opens. Hold this position for 30 seconds. Now we're going to start to stretch out the joint itself. Bring your index finger and big finger to your chin. Before you start, make sure that your teeth are in proper alignment to ensure that your jaw is in a healthy position. Then, to start, begin to push back with your 2 fingers as if you was pushing your lower jaw towards the back of your neck. You can do this also with the heel of your hand for more resistance, but I wouldn't overdo it and I would start off with just the 2 fingers. Hold for 15 seconds and repeat 3 times over. The next exercise is an isometric exercise. I bring both hands into a fist and place them together underneath my chin. As I apply force with my jaw down, as if I was bringing my jaw to my chest, there is no movement. This is because my hands that are underneath my jaw are applying enough pressure so my mouth doesn't open. This is known as an isometric contraction, a muscular contraction without movement. I want you to hold this position for 2 sets of 30 seconds, applying 50% of the max pressure that you can generate. Exercise number 10 is another isometric exercise. This time, place the palm of your hand onto the side of your face. You should be pushing your lower jaw out towards the side that your hand is on. With your hand, apply enough pressure so there's no movement at the jaw, but you can still feel the jaw working and the surrounding muscles contracting. Hold this position for 30 seconds on each side. Isometric exercises are a great way to strengthen the jaw in the safest way possible and are great for improving jaw alignment. We're now going to do a tongue exercise. As you do this, your jaw will move naturally and allow it to do so. Start off by opening your mouth and pushing your tongue into the side of your cheek firmly. Hold this position for 15 seconds and then repeat on the opposite side. Do a total of 3 sets on both sides. With all the exercises and stretches covered, remember to go nice and gently and start off cautious. I promise you, if you do all of these too aggressively, you'll feel like your entire jaw has had a huge workout. So steadily work up on all of the exercises and, most importantly, be patient. Lastly, we're going to finish off by stretching out the Masseter muscle with some applied resistance. Place the side of your hand just below the thumb at the bottom of your cheekbone, and then push up until you reach the cheekbone. Hold this position firmly and begin to open and close your mouth. If you start to feel discomfort as you're doing this, you're most likely doing it right, because as the muscle is contracting and relaxing, you're pushing into it. You can do this by taking the pressure off and use just your thumb, which will make it more bearable and a lot easier. I have put this last because it's the most abrasive of all the techniques covered, and I wouldn't do it on the first time of doing all these exercises and stretches. Complete 10 to 15 slow and controlled repetitions. And that concludes the end of today's video. Thank you for watching and making it this far. If you have got TMJ pain, the first time that you do those exercises and techniques, make sure you start off really softly, and I hope that they give you relief and they allow you to have more range of movement. For more free educational content, make sure to subscribe to the channel, and if you enjoyed the video, make sure to like it. My name's been Travis Tarrant and you've been watching UK Fitness Hub. I'll see you soon.